What's going on, everybody? Thank you so much for tuning in. This is your boy Chad Roper, and I'm here um, with another advocate, Aurora Men's Community Health segment. And this segment, because it's the month of May, is going to be mental health. And I have a mental health expert here with me today. He is the director of the I want to call it the behavioral hospital at Aurora. His name is Dr. Barakat. How you doing, Dr. Barakat?
Good. Thank you for having me.
Man, tell us a little bit about yourself, man. What got you into this?
It's a good question. Well, I actually just started off in business, to tell you the truth.
Okay.
I grew up in Milwaukee. I went to UWM. And they had a good business program. I started off over there. I kind of just fell into it, to tell you the truth.
Okay.
I started some undergrad classes in psych, and I was really interested in it. I was interested in stress and anxiety and things like that because I kind of struggled a little bit with anxiety as a kid, especially like going to school and dealing with stuff over there. So I thought it was really cool, so I got into it and just kept going. 10 years later, just got my doctorate and started to work and just came back to Milwaukee and started to practice here.
That's what I love to hear, man. Listen, all those people out there looking at us at YouTube land, if you have any questions throughout this broadcast, hit me up at text me at 414-899-2222. That's 414-899-2222. So when you started did you start off as a therapist first?
Yeah, actually, when I was in undergrad, I worked with little kids with autism. Like I went to their houses and worked with them. When I graduated and got my master's, I started to work as a counselor, in an outpatient setting, seeing people once a week. And then I progressively started to work. When I got my doctorate, I started working at Aurora Healthcare and started to work in their IOP program. It's an intensive outpatient program for children and adolescents. And these kids struggle a lot in school, so they end up going to therapy for like half of the day and then going to school for the other half of the day. I worked there probably for 10 years before I started this position. So my background is primarily I worked a lot with children and adolescents prior to starting this position.
Absolutely. So now, in working with children, what were some of the things you noticed about them that was similar obviously each case is different, but there are some similarities when you have certain issues. What are some similarities that you noticed in children of color?
Oh man, that's a good question. Yeah, obviously, it's kind of bringing up a big topic that we all should be discussing. A big thing that is true in the industry of psych, whether it's like healthcare in general, but in psych you see it differently, in a sense that patients get diagnosed with disorders, and it shows like research really supports this with certain disorders differently based on their race.
Yes.
And it's just kind of this predisposition and this misconception of how biases kind of play a role in our society. So we had a lot of kids come through the program automatically in our intensive, and this is a high level of care. Intensive things have to be going really wrong for you to end up at that level of care. Where a lot of kids probably start off in outpatient, getting seeing a therapist once a week, just finding out what happened. But we got a lot of children of color end up in our program. They skip all the first part of it because the emotions and symptoms get so high. They end up in our program, and a lot of them end up get diagnosed with disorders such as like conduct disorder, which is like really tough because it really puts you on a different trajectory of treatment. Where other kids get diagnosed with like depression or anxiety, and they have the same symptoms.
Right.
It's just this bias that kind of plays a role, and we're starting to attack this bias through education and understanding and better cultural competency. But that was a common thing that we noticed with a lot of the kids that end up in our program is they bypass all those initial treatments because the access isn't that great for outpatient, where they end up in those more intensive programs.
Absolutely. Now, in the biases that you speak of, because it not only occurs in your field, it occurs in the medical field, it occurs in regular life, you know what I'm saying? What are some things since you are like the director, what are some things that you think that you can do to help curve that or remove that biases?
Yeah, and it all starts with education. We started to do a lot of cultural competency educations. I do them myself. We make it part of our program development and part of our onboarding when we get new therapists coming on, starting to develop teams that are very focused on cultural competency. And Advocate Aurora is really big on DE&I initiatives, like having an understanding of inequities in healthcare in general. But we're making a lot of strides in that area to educate populations and educate people to better understand and better evaluate. And there's tools out there so you can more properly assess people and acknowledge. The first piece is acknowledging that it exists. And people are kind of resistant sometimes in acknowledging it because they might take it as, I'm not racist. It's not about being racist. It's about understanding that there's a structural racism that's going on. That's this. We're all victims of it.
Absolutely. See, I recall doing. I forgot. I think it's called implicit bias training. Hold your mic up. Yeah.
Yeah.
When you hold it aside, implicit bias training, and all of us don't have a choice to have some kind of implicit bias because of how we're taught in the school systems, right? For example, they were giving us examples. One of the examples was ice is bad. Just regular ice, if you're driving down the street, ice is bad by itself. You can hurt yourself falling on ice. But when you hear the word black ice, it's even worse. Or a plague. A plague is a plague. You don't want to be a part of a plague, but the Black Plague. You know what I'm saying?
Yeah.
Even like when you look at certain, like back in the day, the old movies, they would have identifiers of who was the good guy and who was the bad guy. The good guy always wore white. What's the Star Wars? Yep. What was the cat name that wore the white? Luke Skywalker. He had on white. Yep. But then you had who? Darth Vader. Yep. And Darth Vader was in what? All black. Now, you didn't notice this as a kid, but when we started going through these trainings, you start noticing things. And which means, the crazy part of the statistic I heard was 80% of white people have implicit bias against black people. But check this out. 70% of black people have implicit bias against black people because of how we're taught coming up. And it's not saying no, these people are racist or not racist. That's not what it's about. It's about saying subconsciously in your mind, you have this preconceived notion about black people of color because of what you were taught coming up, not even knowing what you were taught. Just little things. So it makes sense. And like you said, it doesn't make somebody racist because of that. It just makes it that we need to change our systems because we should treat individuals as individuals. Yeah. You know what I'm saying? So it makes total for you to say that to me. I really identify with that because of a training I had years ago about something like that, and that makes total sense.
It sounds like you kept a lot of that training because you hit it right on. Because that's how implicit biases exist in our society.
Absolutely.
Because of the way we grow up and the way we unconsciously learn things.
Yes.
And implicit bias leads to like unconscious racism,
Absolutely.
And it creates these microaggressions that makes it really difficult for people to address because it happens because you can address direct.
Yes.
But when it's unconscious, like how do you address that? It makes it more difficult to address that. But
Absolutely.
You hit it right on when you mentioned it.
Absolutely, man. So I kind of understand that because I do a lot of reading because I travel a lot, so I have nothing but time to just try to learn stuff, and it's something that bothered me over the years. So I started to just kind of like look at it. And then when I took the implicit bias training, I'm like, no wonder, even like they talk about police issues, and I know you probably have to help deal with issues to de-escalate things, so that the cops, the first thing somebody want to do is call the police when they should be calling a crisis stabilizer or things of that nature. So it makes sense. No matter what color the cop is, there's some kind of implicit bias that they have no control over. It could be nothing is wrong with them. Their best friend is a person of color, but because of the things they grew up in life, sometimes, some of them are just pure the wrong people for the job. But sometimes it's just the fact of subconsciously they don't even know it. They don't even realize it. So I understand that. And the good thing is there are, like, we just had a school shoot with 16 or 18 children killed. You know, we just had 10 people murdered in Buffalo, New York. You know, now that's different, and they want to blame it on mental health, which mental health is a part of it, but it's more than just mental health. You know what I'm saying?
Yeah,
like
I
you can
agree.
be, you can blame it on whatever you want, but when you killing multiple individuals on purpose, it's deeper than mental. It's something else there as well. You know what I'm saying?
Yeah, I agree.
And I think, what do you think we can do? Like the average person, not the doctors, the people with the expertise. If I'm a good friend of someone and I notice things different about them, how could I help, or how can I approach them to actually get them the help they may need?
Yeah, so you're saying if you come across somebody that may have mental health
Absolutely.
concerns, it could be because there's a stigma that comes to it, especially with certain cultures and
Yes.
certain people's background. I know, people call, like, I know Middle Eastern people have this kind of stigma with mental illness, like it has to be some, physical illness.
Yes.
They're more accepting of it if it's like a physical
Right.
disability or a medical issue.
Yes.
But when it comes to mental health issue, there's a stigma around it. So it's hard to approach people sometimes when that situation comes about. But it's all about phrasing and first, like, opening up the door so you can listen. If you notice something going on with somebody who's struggling with depression or anxiety, or sometimes it comes out as anger, it's okay to open up the door to ask them, what's going on? I'm here to just to listen. You don't want to jump in right away with recommendations telling them you should do this or you should do that.
Right.
Because people most often will be turned off by that.
Yes.
And become defensive because
Yes.
you're telling them to do something. So initially you want to start off by opening up the door for a conversation around it. If you notice something, because when people struggle with mental illness, it's something, there's a significant change in their behavior that just all of a sudden happens. And you can acknowledge that, they can acknowledge that,
Gotcha.
You normally like doing this before. What's going on now? You haven't been, if they normally like going out in a certain place or doing a certain activity, if they all of a sudden stop doing it, you just mention that, what's stopping you from doing this? And then that kind of opens up the door to, conversate about it.
So now you hit on some things. You talked about depression and you also talked about anxiety. Give me some symptoms or signs of those. So let's talk about depression first.
All right. They're both related because
Yes.
they're the most two often disorders that are diagnosed together,
Yes.
depression and anxiety.
Okay.
So when somebody's struggling with depression, oftentimes they'll all of a sudden stop doing things they enjoy doing.
Yes.
It'll mess up their eating, their eating habits. They'll either like decrease their eating, all of a sudden stop eating as much as they should be in a healthy, or they might overeat too.
Yes.
Their sleep is disrupted. They don't get enough sleep, or they're sleeping too much.
Gotcha.
It'll be very difficult for them to get up in the morning. They struggle going to work. If it's a kid or a younger adolescent, they'll all of a sudden their grades will start dropping.
Absolutely.
If it's adult, their work performance will start declining. They may be irritable, like they get just mad quickly when you when you ask them things, or
Yes.
they begin to stay home a lot and isolate. So they won't
Isolation,
talk
okay.
to friends anymore. They won't interact as much as they used to. So those are a lot of things to look at, those more obvious signs.
Anxiety. Let's go there.
Okay, anxiety, man, it can look differently depending on what kind. There's so many different kinds of anxiety.
Let's
So-
break some. Let's
Yeah.
let's jump into some. So
Okay.
give me example of one.
So one anxiety could be a common one is a social anxiety.
Social anxiety. Okay.
So with social anxiety, if somebody's struggling with social anxiety, they struggle interacting with people.
Yes.
Getting in social settings, being one-on-one with somebody and having to have a conversation, that could be really hard. Being in crowded places could be difficult for them. If it's an adult, they'll be isolating a lot. If it's a child, they don't want to go to school. So it's a lot of like isolative behaviors, and their anxiety like kicks up really high when there's a situation that they perceive that attention is going to be on them, or there's some expectations to socialize.
What's another type of anxiety?
So another type of anxiety could be like a generalized anxiety. That's
Okay.
probably the most common one.
Okay.
And generalized anxieties happens in different ways. It's the kind of the definition of it. It can occur just because of a lot of the way they interpret their environment. Like,
Okay.
they could be thinking somebody's judging them, and they feel anxious about that. They could be feeling that something bad's going to happen when they go to a particular destination, so they try to avoid doing that. So it's really general, and it hits all aspects of their life, and they become anxious about every little thing that could possibly happen to them. So they're always predicting the worst case scenario, no matter what the situation is.
Gotcha. Is there another type?
Oh, there's OCD. It's probably
Okay.
another one. So that's an anxiety-based disorder when and it's very specific. You know, you could be like have OCD with cleanliness.
Yes.
You know, people start developing like OCD tendencies when COVID started.
Yeah.
People start developing OCD tendencies about, the house has to be a particular way before they leave it. And you got to remember, like, all these anxieties, it's not an actual disorder unless it's disrupting your everyday life. So
Gotcha.
everybody has a little bit of anxiety, and that's fine.
Yeah.
Honestly, you need a little bit of anxiety to function well.
Yeah.
It kind of gets you going.
Yeah.
Like, if you have no anxiety at all, then you're not going to be motivated to do anything. It kind of kicks you in the butt to make you do things. But then anxiety becomes a problem when it hits a certain level, and
Right.
then now it's disrupting your overall functioning.
Makes sense. Now, we have the pairing of anxiety and depression. What are some ways to get rid of or cure? I don't know if it's such thing as cure, but get past maybe or get through depression.
Yeah.
What are some ways to do that?
Well, the most common way to get through that is through therapy,
Yes.
talk therapy. And you will, honestly, like a lot of the skills that you learn in talk therapy are helpful in your life. There's this form of talk therapy called cognitive behavioral therapy.
Okay.
It really kind of digs into your thought process.
Okay.
The thing you got to understand about emotions is they all are generated by the way you interpret your environment.
Okay.
I always kind of, when I used to do treatment, I used to start off with my patients, giving them a scenario so they understand how powerful the way you interpret your environment is.
Okay, so stop right there.
Go ahead.
Give us a scenario of what you would give, because the people watching right now may need this. So let's give them I'm your patient.
Okay.
Give me the scenario you would give I'm your first day patient let's do that right now in front of everybody.
Good, nice. Just so people know, when a first session starts, it's anxiety for a lot of people.
Absolutely.
I remember having a patient one time when I took him out of the waiting room. I saw that guy darting around the waiting room. He was ready to leave. I could tell. So immediately I finished up with my last session. I finished up with that person. I knew I had to grab him right away. I usually sit down and type my notes before I grab that next patient, but I knew if I did that,
He was
that guy
gonna
was
be
going to be gone.
Yeah.
So I grabbed him right away and brought him in my office. So yeah, so just so you know, that's kind of how a therapy session starts, is somebody's going to open up and ask questions about your background. But you coming into my office as a patient,
Yes.
the scenario that I oftentimes start off with patients, and I did with that gentleman, is setting them up so they understand the power of interpretation. And what
Okay.
I mean by power of interpretation is the way you think about the world around you. So I'll open up by saying, you're feeling really anxious right now. You're coming in my office. You want to work on your anxiety. I want to get you to a good place first. And the way we're going to do that is to help you understand where emotions come from. That's the first place we need to start.
Right.
Everybody needs to understand where emotions come from. Then we can start working on your emotional management stuff, okay?
Gotcha.
Let's say you're sitting at your job, and all of a sudden your boss comes up to you and tells you, hey, at the end of the day, I want to talk to you really quick. So before you leave, can you step in my office really quick? I just need to talk to you. And then your boss walks away.
Right.
Now that leaves you in a situation where you need to interpret it. Oftentimes, we don't even notice it. But the way we interpret things just happens so quickly, we don't notice it. The only thing we notice is our emotional reaction.
Right.
But let's just say you impulsively start to interpret that situation as,
He finna fire me.
he's going to fire me.
Right.
I'm in trouble. I did something wrong. That's it. I'm not going to be able to find another job. I'm going to lose this job. I'm going to be broke. I'm going to be kicked out of my apartment. What kind of emotions do you think you're going to be experiencing with those thoughts? What do you think?
I think I would be frustrated. I would be probably angry. I would probably be scared or afraid, I should say. I would also be anxious for him to have a conversation with me.
Yeah.
Nervous. I guess
Yep.
nervous and anxiousness are similar.
Yep.
So those are some of the feelings I
There you
probably would
go.
have. Right.
Yeah, you start feeling anxious, nervous, and usually right after the emotional experience, a behavior happens. So when people start feeling anxious, you start to feel really anxious or nervous about what might happen, some behaviors might follow that. You might leave early anyway and not talk to him.
Right.
You might be really irritable
Right.
with him when you walk into the office. And there's going to be consequences to those behaviors.
Absolutely.
You're going to leave early and not talk to him. Your boss is going to be like,
You know what
interpret that as disrespect, and that's going to cause some issues.
Right.
So let's go back again to that same exact scenario, okay? So now, your boss, and remember, there's no mood or it's like a flat affect your boss is having. He's not, doesn't look angry, doesn't look sad, doesn't look like, he just says, hey, I want to talk to you, and the day walks away. Now let's say the thought process in your mind is, I'm sick of this boss. He's always targeting me. I honestly think he's trying to get me into trouble. I'm sick of this guy. I can't just keep, he's trying to fire me. He just hates me. What is the emotional reaction you think you're going to get from that thought process, being targeted?
From that process, I'm mad. I'm ready to go in there and talk right now. We ain't got to wait till the end of the day. Let's get it out the way right now.
There you go.
Get it off your chest. What you got to say?
Oh, man, you just went all the way to the behavior right away.
Absolutely.
That's exactly what's going to happen. So you're going to feel angry.
Yep.
And your behavior is going to make you run into that office and pretty much maybe go off on him.
Right.
And what are the consequences of that? Probably going to get fired. And then there you go. Boom.
Absolutely.
Then that's going to create more anger. And it's going to be kind of a self-fulfilling prophecy because you got fired.
Right.
And that's what you're predicting. So let's do another one. So he came in and said that to you. Now let's dig into that. And now your thought process is, I'm such a screw up. No matter what I do, I always screw it up. I can't keep a job. I'm a loser. Just my life sucks. I have no control over my life. What kind of mood do you think is going to be?
That's more than the depressive side.
Yeah,
you're gonna
there
be
you go.
You're gonna be down. You're gonna be kicking yourself in the butt.
You're going to be feeling depressed. You're going to kind of you might, like behavioral, you might just leave because you're so depressed and just give up and quit.
Yep.
So you might quit the job to beat him to the punch, because
Right.
you feel like he's going to fire you anyway. So you want to try to gain some kind of control over your life.
Right.
And sometimes people with depression do that because they want to feel like they have some control. So they might take control of it in a negative way that might lead to negative consequences. Now they're going to be at home, isolated, without a job, thinking about, and then the depression is just going to get worse.
Absolutely.
So the same exact situation created 3 drastically different emotional responses.
Right.
What we teach in therapy is to be more fair about the way you're interpreting your environment. Be more realistic about the way you interpret your environment. So when your boss walks up to you and says those things, what we're looking for is for you to start weighing out evidence. What is the likelihood I'm going to be fired? I do a good job. My last performance review, I actually got a pretty good performance review. I'm
Right.
probably not going to get fired. You know what? I know that my job has this process that you have to go through before you get fired. I've
Right.
never gotten a warning. I've never got any issues with
Right.
that. And even if I did make a mistake or something bad happened, they always give you a chance to learn from it and grow from it. That's the part of growing in an organization.
Absolutely.
So now your mood's going to shift big time where you're going to be kind of content and just ready to talk and ready to find out what's going on because you feel like you can get through whatever it is. So
Right.
this may seem very simple, and I always tell patients this, but you take years and years and years and years to develop bad habits of thinking.
Right.
And these bad habits of thinking lead to these emotional reactions. And I always give the same scenario to kids in adolescence, but I do it in school. Like, let's say your teacher came up to you
Right,
and told you they
absolutely.
want to talk to you. So,
Yeah.
And then I use different verbiage with it. I tell them, your thoughts trick you to feel certain ways, just to
Absolutely.
make it more fun for them and more engaging for the kids in adolescence. So, but it's the same process. It's cognitive behavioral therapy, teaching you to think in a more realistic way. Now, it's not thinking positively, it's thinking in a more realistic way.
Right. That makes sense, man, because a lot of times situations that either elevate or escalate is because of the interpretation in that person's mind, where realistically it's literally just that individual. When realistically, the boss probably was calling me in there to tell me how much of an amazing of a employee I would have been,
Exactly.
and he happy to have me on the team, and blah 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 blah. But what I've realized is what people don't do is give themselves enough credit for what they do, and in that comes again from when we were coming up, that uh, you should work hard, but when you work hard, you just stay at a humble level. Well, realistically, you should pat yourself on the back sometime because that hard work is actually paying off. And but because we're taught in our school system to be employees and not employees and not employers, we still have that, I guess, detrimental mindset, for lack of a better term. You know what I mean? Now, in your time, in your time doing the profession you do, how often is it that you see results that you're pleased with, where you see extreme strides from individuals that take this thing serious? Is that a high percentage thing?
Yeah, I mean, honestly, there's a lot of variables that play a role in that.
Yes.
You know, the patient really has to be engaged and buy into the process. And when I talk to students and we get student therapists and I'm kind of teaching, I always tell them, as a therapist, you're kind of a salesperson too. My first sessions, I want to sell to the patient that what I'm going to give them is going to help them. That's the first piece. So once you notice that the patient is buying what you're giving them, and you're not swindling them, you're not a used car salesman,
Absolutely.
You're actually selling them something that's going to work, but they have to believe it. They have to believe it. So you have to spend some time selling them the treatment that you're giving them. And that patient that I mentioned early on that had that anxiety darting around, he was better in like 8 sessions. I swear he looked a lot better after that first session. I'm not trying to sell you therapy because I don't do therapy anymore.
Right.
So he felt better after that first session because he bought into that process.
Absolutely.
That his thinking is going to help the way he feels, and then it's going to help his behavior. So
Absolutely.
I see it work a lot with patients who are engaged. And if you're coming in there early on with more not significant anxiety that's completely disrupting your behavior, you're gonna get better. I see a significant portion of those, like a high percentage of those patients, get better within 8 sessions. So you got to catch it right away, and then you teach them those skills. You mentioned you got to pat yourself in the back, right?
Absolutely.
That's self-care.
Yep.
So therapy doesn't stop once you're done with therapy sessions. It's learning skills to take care of yourself and understand that your mood needs as much as attention from you as you do your body. You know, we grow up, we know that we got to eat well, we got to exercise. We know all the things we need to do to take care of our physical well-being.
Absolutely.
But we never think about things to be proactive about taking care of our mental
Right.
well-being, mental health well-being. We never even think about that. We never talk about that.
Right.
But there's a lot of things you could do proactively to make yourself more resilient.
I like that. So now, since you went there, let's continue to go there. Let's give our viewers some things of what we can do because we know what the problems are, right? But I'm a solution-based person, so I don't want to just talk about the problem. Let's turn the corner and talk about some solutions. How can we do some of those things you were just speaking of?
Great question. And I'm glad you asked that, Jay, because building resilience is the key. Because, and the way you do that is you have to engage in self-care. And people all the time are like, what is that? You know, self-care can look differently based on the person.
Absolutely.
Sometimes we get busy in our everyday life and we just kind of run around. We don't stop and give ourselves breaks.
Right.
Sometimes we need like just quiet breaks away from things, you know, disconnect from our phones for a little while, disconnect from people around us just for a little period of time. It could be just 10 minutes, honestly. So sometimes you could do things like that. Other times there's things out there like engaging in mindfulness activities, and there's videos on YouTube that teach you deep breathing techniques, mindfulness, meditation,
Yes.
you know, all these different things that people don't access, but those are proactive ways to truly begin to build resilience and build your ability. And when I say resilience, is being able to bounce back.
Right.
You know, because people have a trouble sometimes bouncing back, especially the younger kids right now, because they need results right away.
Yep.
And they interpret failure as the end of it all. But failure is a part of how to becoming successful. Is you have
Absolutely.
to fail. So it's a part of that. So that's another part of it is working on your thought process. You don't have to be in treatment to do all that cognitive behavioral stuff.
Right.
You can actually become higher performance by working on that cognitive behavioral stuff.
Gotcha.
And it could be anything. It could be like Giannis shooting free throws, you know?
Yep.
It's like, how does he interpret when he misses a free throw?
Right.
That's why he became more resilient when you compare him to other players.
Right.
Ben Simmons, who had really struggled because he didn't engage in that process. He didn't care. He just kept. That's what separated those two guys.
Absolutely.
Is one guy didn't care if he missed a free throw. He'll go and dunk on somebody the next play when he airballs a free throw.
Absolutely.
You know, so it's like you get, yeah. So there's a lot of proactive ways you can start getting involved in the way you think about things and practicing those skills that help you get there. So it's a process, but it really helps you to be resilient in the long run.
That's perfect, man. Now, you were speaking of young people, and I was thinking about social media. Now, social media just don't affect just young people. I see 50-year-old people being affected by social media.
Yeah.
As a therapist or as a professional person in that realm, what do you think the impact of social media does with a person's mental health?
That's a great question. It depends how you use it.
Yes.
So you mentioned young people. Oftentimes they use it as a measure of, where they want to be in life. So they compare themselves. Adults do that a lot.
Absolutely.
So oftentimes when we're on social media, we're seeing what people want us to see.
Absolutely.
And then we're interpreting that as real life. A lot of data actually does show that there's depression is related to increased like social media intake. Like if we spend too much time on it, there is an increased likelihood that depression can be a factor.
Right.
So it all depends on how you're using it. Oftentimes younger people do access it to compare themselves to others.
Yeah.
And with younger people too, back when when I was in high school, there was no such thing as like social media and the cell phones we have right now.
You and me.
So like
both,
when there's like negative interactions at school, you go home, you're done.
it's over with.
It's over. But then now it follows you.
Yep.
You'll get a notification on your phone, even when adults.
Yep.
You can have a negative interaction or see something on a phone where before you can't. You get home, you're done. You're not going to be triggered by anything.
Yep.
Now you can be triggered just before you go to bed. If you check the internet, you check things that are online, it could be something stupid somebody says on there that triggers you, or an opinion that somebody has that triggers, then you're upset. So that's the role social media plays in our life. It's just we got to be aware of that. I'm not saying social media is bad. Obviously, there's a lot of positive aspects about it.
Absolutely.
It all depends on how you use it.
I mean, yeah, right now what we're doing, this could be on social media. This is a positive thing.
Right.
So I agree with that 100%. I just think it's a tricky thing because, like you said, you're basically seeing people's highlights of their life, and then you comparing it what your everyday life is, which is not realistic, and it goes back into the cognitive piece you were speaking of. You have to make sure that everything you do follows in line with your self-care. So if there's something you're looking at or consistently subscribing to that's not helping your self-care, that's something you might want to put on the block list. You know what I mean?
Yep.
That makes sense.
Yeah, it's key.
Let me look at a couple questions that was sent in from those watching us. All right. I'm not going to say names because I don't want to put people business out there. This question says, I'm an artist and I've been struggling with my creativity, which makes me think I'm not up to the task of being an artist anymore. Is there a such thing as being too into something or obsessed with something because you want to win so bad? Or is that just me taking it to the extreme?
Well, that's a really good question. That kind of makes me think about that example I gave earlier on. But you have to when you're engaged in an activity and want to be successful in it, right?
Absolutely.
You have to set reachable goals for yourself, just so you can kind of get the ball rolling and get a momentum going.
Right.
Sometimes when we find ourselves kind of stuck, it's because we don't have a clear destination on where we're going. So for this particular artist, like, what do you want? What is a reachable goal that you want to accomplish? It could be performing somewhere. It could be whatever you do. for a living. It could be, and just set that expectation. It gets kind of the ball rolling and gets you going. And we talked a little bit about cognitive behavioral therapy. What kind of thought processes do you have when you interpret failure? What is failure to you?
Right.
You know, so you got to understand that, put that into perspective. You know, failure is part of success. So oftentimes people who are struggling in that industry
Yeah.
might overinterpret what failure is. And we know for a fact that the most successful people that you see these days have failed a lot.
Hundreds and hundreds of times. Yeah, failure basically is your stepping stool. That's why I look at it.
Yep.
And that's what I would tell the young me back in the day. That's what I used to tell myself when I was younger, that you got to take your lumps in order to do it. But obviously, the stigma of mental health wasn't as, I would say, popular as it is now. You know what I'm saying? I was talking on a panel yesterday, and I was saying when I grew up, they would tell you to go to church and pray about it and that type of thing instead of going to talk to a therapist, because they would use the term shrink back in the day, and they would call you crazy for having a conversation to get your mental health together. But now it's not shunned upon as it was back in the day. So, and another thing I would say to that person as well is that if you do not have failures, you do not have lessons, because with every failure comes a lesson if you're in the right mindset and a mind state. So you have to have failures, because if you look at when you watch the NBA finals is on, or the NBA playoffs is on, when a team wins, when you watch the interview, the player that they're interviewing or players that they interview, they talk about all of the things. We moved the ball around well. We had good movement on defense. We did good switches. You know, they give you that type of thing. They never tell you what they did wrong. Dog, you had 5 turnovers though. You know what I'm saying? The difference is they didn't score on all the turnovers you had. You know, so they'll give you all of the things they did well. But then when a team loses, man, I got to do better. I gotta shoot my precise shot 1 for 10, and then we weren't hitting our wide open shots. Our defense, we kept leaving the corners open. They breaking out every aspect of what they did wrong, as opposed to when they win, they just point out the few things they did right, and we gel well. So if you take notes of just regular things in life, you can see it happening all the time.
That's a good example, because when you think about like an NBA series,
absolutely,
you lose a game, now it's the end of the world.
Right.
You win the next game, oh, we're going to win the series, and you lose the next one. Oh, you know, it's kind of this emotional kind of like how you're interpreting the process. That's the reason why I stopped watching. That is really hard to watch the Bucks, because I just like I get like that when they lose. I'm like, they're done.
Dog, listen, I was at Game 6, and I'm like, man, and I'm yelling to them, dog, guard the man in the corner, bro. I can hit. I'm not an NBA player. I can hit 7 for 19 if you leave me open 16 times. You know what I'm saying? I can imagine somebody do this every day. This all they do. This is what they get paid millions of dollars for. Of course, they gonna hit your shot. So I understand 100% what you're saying when you say that, man. Let's grab another question, man. Hold on, let me get in here. All right, this question says, I'm a stay-at-home mom, and I want to know. I mean, I feel like that I'm not living out my potential because I have to take care of my children. I think I'm depressed, but what are some signs that can either help me understand if I'm depressed, or what can I do to pull myself out of this funk that I'm in?
That's a really good one. So one of the treatment options or treatment interventions that we do is called behavior activation.
Okay.
So what that is it's the belief. It's kind of like it is part of cognitive behavioral therapy, but what we're trying to do is get you to start behaving in certain ways that up your mood.
Gotcha.
So this question is coming from, there's some things that she wants to do in life that she feels like she isn't doing.
Absolutely.
She has to figure out those are and do at least a portion of it, or a variation of it.
Okay.
To see what happens with her mood and get her kind of going. If she's struggling with depression, she's probably sleeping a lot. She's having some of those symptoms that we mentioned, not eating right, having a hard time caring for others, caring for herself.
Yes.
If it's that situation, I would recommend, getting an evaluation,
Yes.
going in and seeing somebody. And a really, and people don't know this, but a really good place to start is talking to your primary care physician, letting them know.
Gotcha.
At Advocate Aurora, actually, we screen everybody. It doesn't matter if you're walking in to see your doctor or you're walking in a behavioral health service line. they're going to ask you questions to see if you're depressed.
Yes.
Just to see if they need to refer you to somebody. So next time you go in there, answer those questions. If they don't ask you those questions, you let them know that you're having these symptoms. And they'll do an assessment on you, send you somewhere, and give you a referral so you can get a full assessment to see if there's depression going on. Because if it's depression, you need to see somebody.
Absolutely.
But if you're starting to feel kind of down on your mood, there's some things you can do to up it. And a lot of times you want to do things that get your mood going. And if there's things in your life that you feel like you're not accomplishing, do them.
So now there are people out there that may not be insured that may need some help. You know, I like to also make sure that, you know, because most people like free things. You know, we got free the Bucks won. You got free taco. Everybody gonna get a free taco. You know, stuff that ain't gonna do nothing for you. So, are there services or things that people can reach out to get help, even if they don't have not covered in insurance, they don't have revenue to spend on something like this? Are there things out there that they can partake in?
Yeah, I mean, like I mentioned before, if you go to your primary care physician and get an assessment, they'll find out what your situation is. But we also have it at Aurora Family Services, and it's kind of a part of Aurora that really focuses on populations that are underinsured or not insured.
Yes.
So they can get them services that they need, and I'll provide you that information.
Yeah. So what we're gonna do is throughout this broadcast, I'm gonna have them post the playback of it. I'm gonna have them post exactly what he's speaking of. So if there's some help you need, we're gonna put numbers up there, suicide hotline numbers. We're gonna also put the information for what he's speaking of as well, because I want you to know that there are things out there for you to get this help, because that's the thing. A lot of people don't get help because they think, man, I don't need no another bill. This is not gonna be a bill, because that's what I'd rather have a bill and be alive than not have a bill and be dead, because you can't do nothing if you're not on this earth. So we're definitely gonna provide that information.
Yeah, it's good. And I just want to say, if it's an emergency situation, you need to just go to an emergency room and get assessed right there.
Absolutely.
Avocor also has a 24-hour intake department. It's kind of like a psych emergency room. It's in Wauwatosa.
Okay.
So if it's an emergency, you need to get evaluated right away.
Absolutely, man. So listen, Doc, last question of the day. This coming from me. When you look at the state of the world right now, do you think it needs more mental health support, or do we need to start thinking about how we're training our children so by the time they're our age, this kind of mental health struggles that this world is having would start to decline because I always was taught, if you plant seeds and take care of whatever it is, they'll grow properly. But if you just plant something and then you don't water it like it's supposed to be watered, or you don't give it enough sunlight, then it can turn out, it can be ruined. And I think that what we're doing right now is a disservice to our young people, because we're planting these seeds, we're having these children, but we're not giving them the things from the beginning so by the time they're our age, they're functioning at a high level. So what's your take on that?
I mean, obviously, as a psychologist, I'm going to promote more mental health
Absolutely.
awareness, and I'm going to do that again. And a big thing that I think we could do better with our kids is teaching them some of those skills that we talked about earlier on. And when I say resilience, like kids these days, like the way they interpret things that go wrong, they're told they did wrong. They're not explained the process of how to change that direction. They interpret failure as the end of the world.
Absolutely.
They don't want to be a loser, you know. They're not understanding that. And you described that very well about lessons learned, you know.
Yes.
That's a part of teaching kids and not making it embarrassing talking about their emotional experiences, you know. It doesn't have to be anger. Like, open up and expanding their language around emotions. You know, it's not all just anger.
Absolutely.
And a lot of times when I work with kids and I tell them, what's going on? Like, what's getting you? It's always anger.
Yes.
They never want to say they're depressed. They never want to say they're nervous a lot. They're anxious a lot. They never want to say they're sad a lot. They want to say they're angry because that's something that they feel like they have control over, and that's something they probably hear a lot. And that's what oftentimes symptoms look like with younger kids. You
Yes.
know, they externalize their symptoms.
Right.
They can get aggressive. They'll get oppositional. Then that's why they get misinterpreted as a different, as a different disorder. Yeah, and they're really struggling with depression or anxiety. So we need to learn more, and we teach our kids more about the emotional experiences that they're having.
Man, that's beautiful, man. So we're going to end it right there. I want to thank everybody for tuning in. You could have spent your time doing anything with anybody, but you chose to spend it with us. Doctor, I really appreciate you for coming, man, dropping these gems off, dropping these jewels off, man. And this will conclude this episode of Advocate Aurora's Men Health Community Connection. Thank you for tuning in, and thank you for coming. Have a blessed one.